If you've ever declined pre-anesthetic blood work because it felt like an unnecessary upsell, I completely get it, and you're definitely not alone. But here's what many pet owners don't realize. A dog or a cat can look completely healthy on the outside while having kidney disease, liver disease, anemia, or electrolyte abnormalities that dramatically change how we anesthetize them. Let's look at what we're actually checking and why it matters. Pre-anesthetic blood work isn't about checking a box. It's about making anesthesia safer. Before anesthesia, we're going to ask three important questions. One, can this patient safely metabolize anesthetic drugs? Two, can they maintain normal blood pressure and oxygen delivery? And three, is there a hidden disease that we don't yet know about? So let's walk through what we're actually looking for. We're going to assess the complete blood count, or CBC. We're going to look at red blood cells. And if the red blood cell count is low or your pet is anemic, it's important because red blood cells carry oxygen. And during anesthesia, oxygen delivery becomes even more important because anesthetic drugs often decrease breathing and blood pressure. So a severely anemic patient may need a different anesthetic plan, or surgery may even be postponed. We look at the white blood cell count. Those help identify infection and inflammation, and they're super important in the healing process. A high count may suggest an infection somewhere in the body, and a very low count can mean the immune system's compromised. Both situations can influence anesthesia and recovery. We're going to assess the platelets. They're responsible for clotting, and if they're dangerously low, even a routine surgery can become much riskier because bleeding may be difficult to control. We're also going to look at the chemistry panel. Kidney values like BUN and creatinine. The kidneys remove many of the anesthetic drugs from the body, so if kidney function's reduced, then drugs may last longer than expected. Kidney disease also increases the risk of low blood pressure damaging the kidneys during anesthesia. So these patients often benefit from extra IV fluids, blood pressure support, and carefully selected drugs. We're going to look at the liver values, ALT, ALP, AST, and bilirubin. The liver metabolizes many anesthetic medications, so if liver function's impaired, drugs can persist much longer. Abnormal liver values don't automatically mean anesthesia isn't possible, but they often change which drugs we choose. We're also going to look at blood glucose. Low blood sugar can cause weakness or seizures that delay recovery. High blood sugar may suggest diabetes or severe stress. Either way, we want to know before anesthesia, not during it. And then the electrolytes, we hear about them all the time. Potassium and sodium and chloride, they all help regulate nerve function, muscle contraction, and heart function. Too much or too little potassium can trigger dangerous heart rhythm abnormalities while a patient's anesthetized. We'll also look at total protein and albumin. Albumin is one of the most overlooked values. Many anesthetic drugs bind to albumin in the bloodstream. So when albumin's really low, there's more free drug available, making some medications much more potent than expected. Low protein can also suggest liver disease, kidney disease, intestinal disease, or just poor nutrition. Calcium. Abnormal calcium can affect muscle contraction and nerve function and the heart. Severe abnormalities may require correction before any elective procedure. Should we check clotting times or clotting tests? Well, for healthy young pets having routine surgery, we usually don't. But if we suspect liver disease or rodenticide exposure or certain inherited bleeding disorders, or your pet's having a procedure with a high risk of bleeding, clotting tests like PT and PTT become very important. Now, here's the thing. Most blood work comes back normal, and that's a good thing. That's good news. But occasionally we discover kidney disease, liver disease, anemia, diabetes before anesthesia instead of during a complication. Sometimes blood work changes nothing, but sometimes it changes everything. Pre-anesthetic blood work isn't about making surgery more expensive. It's about reducing surprises and making anesthesia as safe as modern veterinary medicine can make it. Because the best anesthetic complication is the one that you prevent before your pet ever falls asleep.